Thank you very much. It's a pleasure to be here.
Thank you. Can you all hear me? Yeah, you can. Yeah. Thank you so much. As per the session plan, this should have been followed by an online session, but unfortunately there is a technical challenge. We are still sorting it out. So I thought that it would be great to again discuss about climate change and mental health. Perhaps it will really help us to really understand the holistic aspects of health. So may I request Dr. Lilis to make the next presentation, please,
Okay.
climate change and mental health.
Okay. Thank you, moderator. Good afternoon, ladies and gentlemen. My name is Lilis. Can you show my slide? I will present about the climate change and mental health in Indonesia, Indonesian older population. Because I only have 5 minutes, so I have to present it quickly and briefly. Okay. This is the content. This is the content requested, and I will present. And Indonesia experiencing aging population, and as person age, they may experience certain life changes that impact their health, including mental health. In this situation, not all other person could adjust to this life change. Some may experience feeling of grief, social isolation, and also loneliness. If this feeling persists, they can lead to mental illnesses, such as anxiety and also depression. Therefore, next slide, please. Therefore, mental health is important and should not be ignored, especially for older person. Also related to the climate change impact. According to the climate change, we found the data from BMKG that air temperature in Indonesia have continued to rise over the past 40 years. So you can see in the slide, average annual air temperature in Indonesia. This is some examples about the impact of climate change to some like floods and forest fire, and so on. Should I wait or not?
So I think
Okay.
let's get
Because
the
I have
slides.
limited time.
Yeah. So,
Okay, so maybe I continue.
No. Let's see whether we can get the slides up.
Oh, okay. The result, maybe you can. Happen. Okay.
It is also creating stress and anxiety for the presenter and for all of us. So let's relax. And I think since you have got only 5 minutes, it's important that you also flash the slide. That's why I have paused.
So have to continue first, and then there's
Are you fixing it? Okay, why don't you continue? I think it's, yeah.
Okay. I will continue my presentation. Uh, from our study, we found that prevalence rate of depression female more than male. And the prevalence rate increase with increasing age of older person. So it is very important to know. The prevalence of depression is high in older person, especially older person with lower education, not married, living in rural area, and living alone. Also, we found that older person experiencing anxiety and also sleep disturbance. We found also negative correlation with the social engagement and spirituality. It means that mental health, especially for depression, is decreased because older person active in spirituality and also in social engagement. Next slide. This is about the knowledge, perception, and practices of older person. Most of respondents had heard about the climate change, but they were still limited in terms knowledge about the climate change risks to mental health. Next slide, please. Yes. Access to climate change information, it is very important. Understanding how to adapt to impact climate change. The main difficulties for respondents in coping with the climate change, including a lack of knowledge, skill, and financial barriers. I agree with you in your presentation. Is one point is finding. Some practices to adapt to the increasing air temperature, such as drinking more water, opening windows, taking a shower, staying at home, taking shelter in the shade, and also using air conditioning. And for additional, the older person also active in the spirituality and social engagement. This is our recommendation based on our study, strengthening the social involvement for the older person by joining the group. Maybe in Indonesia, some of group of older person like BKL from BKKBN, Posyandu, Pusaka from the Ministry of Social Welfare. Also activities such as spirituality and gardening, I think is very important for adaptation to the climate change, and go green activity. Establishing sustainable, multi-sectoral, and community-based health preparedness and care to facilitate recovery from climate-related hazard with more accessible and acceptable. The strengthening of the person's mental health care in the community and should be part of the routine health care system, including the impact of climate change. I think we have to add the climate change impact. To involve all related organizations, agencies, and individuals and collaborative effort between government organizations in any levels. I mean central level, national level, also the local level, and NGO to improve in successful education, training, and information resources. Next slide. This is the last slide. Raising awareness about formulating health policies for preventing and treating mental disorders, especially for older population, through develop guidelines for mental health and resiliency strategies. I think we in Indonesia, we have to develop this guidance. Counseling and dissemination on climate change, and also on mental health. The next recommendation, further investigation are required to better understand the best way of resiliency and anxiety to identify the robust predictors and provide appropriate intervention, because I know that some study is very limited about the climate change and mental health. And the last, to develop mental health as well as older person disaster preparedness. I think this is my presentation. Thank you very much for attention. Thank you.
Thank you so much, Dr. Lilis. We heard about the overview of heat stress, and then we also talked about mental health and climate change. Now, my Zoom is up now, so let's get back to the heat action. Mr. Sachit Boite will be online, and he will be making presentation for 15 minutes. So, Sachin, over to you. Can you hear us, Sachin?
Yes, I can clearly hear you. Can you hear me?
Fantastic, Sachin. We all are here in the room. The room is full, and we are expectantly looking to your presentation. And over to you. And you have got 15 minutes, please.
Excellent. Thank you very much. So I'm Sachin Boite. I'm the Director for Climate Resilience for C40. I'm dialing in from London, hopefully to present on heat action planning, but also to add to the technical complexity of this conference. Hopefully everything goes smoothly. So for those of you who don't know, C40 is a network of 100 world-leading cities that are working to confront the climate crisis. The 100 cities are global cities with almost equal representation in global north and global south. And overall, we represent 600 million residents, a 12th of the global population, and a fourth of the global GDP. So the potential for impacts for action is great. So what we do is we really work with our mayors, work with our cities to raise climate ambition, to meet our 1.5-degree target, to ensure communities are resilient and thriving, and really build a global momentum in order for us to ensure that the world is safer despite climate impacts. So just focusing now on heat risk in cities. Heat risk is real. We've observed that in the last 20 years, in each of the regions, we've seen a larger number of heat waves. If you look particularly Western Europe, Western Asia, Northern Europe, and Eastern Asia, there's been a huge spike in the number of heat waves recorded. So it's real and it's serious. Cities particularly are at a higher risk because of harder surfaces and a lack of greenery. Cities are typically 6 to 10 degrees hotter than surrounding countryside. This is a phenomena that we call urban heat island effect. And just zooming in a little bit further, not everyone in cities is affected equally. We've seen that the more vulnerable, the aged, children, migrants especially are affected disproportionately. Even in 2015, this is a map of Karachi. 2015, it faced a major extreme heat with thousands of people hospitalized and hundreds of people recorded death. So what are we doing within the cities that C40 is working with? First of all, we are a community of practice with under a banner called a Cool Cities Network, and this again I think is a very well represented network of cities. We focus on wide-ranging solutions, including heat mapping to better understand the prevalence of heat in cities, to support local organizations in emergency management, but also to ensure that there's long-term planning in such a way that cooling solutions are embedded in the urban environment, and they could be artificial solutions as well as natural solutions. And equally, they could be physical interventions, but also could be land use planning and building regulations. Our purpose is to bring cities together and and make sure that cities are not alone. These solutions and these problems are shared, and they're supporting each other. The research is clearly showing us that we're headed towards a future we don't want. We're looking at 1.6 billion people facing extreme heat by 2050. We're seeing the cost of lives, as well as cost in terms of finance, is huge. So it's really important to take action. Cities are already taking action. We look at case studies. Cities are implementing cool surfaces. They're measuring the benefit of heat action to health, but also quite importantly, looking at the nexus of heat and equity. Again, I think this kind of focuses back onto the inequitable impacts of climate change, particularly extreme heat. We're also looking at providing technical assistance, particularly in cities in Asia, where the heat awareness is increasing, and cities are really getting supported from, or need support to identify hotspots, so that the most vulnerable are supported as a priority. So in terms of actual solutions, Ahmedabad is a really leading city in this. Ahmedabad Heat Action Plan includes a comprehensive set of actions, all the way from early warning systems, increasing public awareness, building capacity of city professionals, but also medical professionals, and then also putting in some physical interventions that reduce heat exposure and to extreme heat, particularly to protect the most vulnerable. One of the main components and low-hanging fruits is to increase public awareness. And this is done through a variety of media, hoardings, digital campaigns, social media campaigns, training campaigns over the city. And even in the last 10 years or so, as a result of having a very robust and implementable heat action plan, Ahmedabad has shown the reduction in both in terms of heat stroke cases and in heat stroke deaths. So again, just to reiterate, heat is real, and it's really affecting people, but at the same time, there are solutions that cities can implement in order to protect, particularly the most vulnerable. But this is a case in Barcelona, where the city is working with all the care homes and implementing solutions particularly targeted to seniors and people with disabilities. They're looking at retrofitting buildings to improve thermal comfort in buildings. A thing to note is most deaths from heat stress occur inside buildings, and ironically, they occur at night, when particularly the aging population and senior citizens are unable to access help. So it's worth noting the importance of indoor air temperatures and the time of death is a critical thing. So cities like Barcelona are really addressing that through interventions directly in care homes as a priority. Vancouver is experimenting with new cool kits that it distributes within the community. Again, prioritizing people at higher risk. They've identified people with spinal cord injuries at being the highest at risk, and looking to support people with disabilities and aged population. Buenos Aires is delivering training to an awareness directly to the elderly. And lastly, it's my last slide here, Kuala Lumpur. We're working with communities through targeted community engagement and developing solutions, both in terms of spatial solutions as well as socially oriented solutions, working directly with the community in supporting the aging population. Thank you very much.
Thank you, sir. Thank you, Sachin. A round of applause from here. I think you can hear. So thank you so much, Sachin. So we have heard very good examples across the cities, and especially from the HelpAge International perspective, I also would like to share one innovation experiment what we are doing in Latin America. As you know that we also do age-friendly cities, so quite a lot of focus on accessibility and so on and so forth. But we are integrating that age-friendly cities model with climate resilience model. So how communities and individuals can take a leadership. That is more important because some of it, what Sachin has just said, is more infrastructural, which are the things government must do. But as communities, what are the local solutions we can find to really address the issues of heat stress going forward? Thank you very much, Sachin, once again. And now I will pass on to Dr. Sylvia and Lara Sid. We are moving a bit to social protection and climate change and how social protection mechanism can be used to adapt to climate resilience. Over to you, Sylvia.
Thank you. Thank you very much, Cherian, and I'm really delighted to be here with all the colleagues and network members from HelpAge as well as other partners. We will focus on the social protection angle when it comes to heat waves. And perhaps if we can just move directly to slide number 5, because I don't want to repeat the information about the trends in, of course, increasing heat waves, the climate change impacts, which I think already have been quite well highlighted. The recent paper from Nature Communications, which really showed that Asia is the #1 region, which of course is most exposed to the climate change impacts, and additionally, as we all know, of course, has the largest proportion of older people globally. So going back to the topic of adaptive and shock responsive social protection, recently we have published a report, and the link is just here on the slide, but you can also very easily Google adaptive and shock responsive social protection HelpAge. You will find it, or you can just request it from us. We will very willingly send it to you. And the report is mainly focusing on is composed of 2 parts. The first part is a literature review when we are looking really at various factors which affect older people's vulnerability, risks, and exposure to various covariate shocks, in particular those which are climate related, and also the second part which is giving some kind of concrete solutions on how to really design an age-sensitive, adaptive, and shock responsive social protection. And you may be asking yourself, why do we need it? There is so much noise now about adaptive shock responsive social protection. We see many publications on this topic, but unfortunately, so far we haven't seen any focus on older people, which is quite worrying, because as we know, older people are one of the most at-risk groups. Next slide. So we have identified through this literature review various factors which affect older people exposure risk as well as resilience to climate change impacts, including, of course, those related to heat waves. And those can be at different levels. Of course, there are micro level, individual level factors, the household level factors, as well as macro level households. And I think those are the usual suspects: gender, disability status, health status, migration and minority status, but also those more systemic factors, such as, for example, social protection systems. A well-designed social protection system, of course, is going to have a great effect on how much you are going to be affected by various climate change risks, right? If you are immediately going to have access to funds, access to cash transfers, access to other forms of social protection, of course, you are going to cope much better with those various climate change impacts. Next slide, I will just show one factor which was highlighted through research. And this is a table focusing, of course, on our Asia region. In the report, we have, I think, a table with the least developed countries. And it is showing the data from the ILO Social Protection Dashboard. And this particular data is the contributory social protection legal coverage for old age. And if you are looking at the last column, just at the last column, those are the gender differences between males and females. And it doesn't really need a rocket science approach or skills to see that all of those values, except for one, are positive. And what does it mean? Of course, it is the difference in terms of the percentage points, and it is showing that the difference is positive for all of the countries, with the exception of Palau. I don't know whether we have a colleague from Palau here, but for all of the countries, with the exception of Palau, the values are positive. For Cambodia and China, the difference is 0. So, of course, we see very stark gender differences when it comes to the coverage in social protection. And I know that ADB colleagues are also working on this, on the gender aspects of heat waves. Next slide, please. So how do we design an adaptive and shock responsive social protection system? Of course, there are various elements when it comes to the design, but we need to really start with a very efficient legal and policy framework, which is going to provide the guarantees for all the people to have access to that social protection. And importantly, not only those kind of narrative guarantees, but also specifying what are the financial mechanisms, what kind of money we can actually access and how when a shock is going to strike. So that is very critical. And then, of course, we have various kind of elements of the design, such as horizontal expansion, vertical expansion. We know that, for example, horizontal expansion was widely used during the COVID era, so that the eligible populations have been expanded, and then vertical expansion, of course, we can quickly top up the benefits which the eligible populations already receive. And during the process, we also need to, of course, remember the role of the Older People's Association in terms of advocating for those changes, but also supporting evidence generation and various accountability mechanisms. Next slide, please. Registries are very critical, and I don't know whether later maybe the colleague from the Philippines, she will want to speak about the Lastahanan system. Of course, we know the social registry systems, they are quite well developed already in various Asian countries. We know in Pakistan there is, I think, a very well developed social registry. In Indonesia, more and more coverage is also being added, but of course there are challenges in terms of updating those registries. I think in the Philippines it's every 4 years or so. So of course, it is very critical that those systems are interconnected, operational, so that the beneficiaries can very quickly be identified and access the help which they need. Next, please. So in terms of the next building blocks, now how? If everyone is already in that database, it is easy to access the information. From the systemic point of view, of course, it is very critical that the older people can also easily access this information. So how they can access, I mean, of course, there can be various radio campaigns, but also through community health workers, for example, in the remote areas. That is very critical, and also the delivery mode. How can actually that help reach the populations in need? Not all the people we know have a bank account, not all of them, of course, have the digital skills, so that also has to be considered next. And also very critically, when it comes to the social accountability mechanisms, next slide, older people also have to be involved, and we have various examples in the help page. Work, for example, our Irish aid-funded project, where really various innovative structures have been created. For example, what we call the older people's monitoring groups, where really they monitor how the social protection payments are being delivered, and also they create their own grievance system, complaint system, where actually older people can also submit their complaints. Next. Very briefly, I will just highlight a few examples. I think my the previous speaker was already highlighting examples from cities, and our CEO Cherian also highlighted the example from Latin America. In Asia also, in Pakistan, in India, we also do quite a few projects which are related to heatwave response, and of course they are project-based, so the scale is not very large, but what we are aiming at really is to scale up this response and to make it more systematized, so that when that shock hits, then of course more and more people can be covered by those responses. So I think we all know about those mass media awareness campaigns, cooling station camps, disseminating various heat wave kits. Next, please. And similarly, as I mentioned in India, but interestingly, those kind of very immediate emergency response actions, for example, when you distribute the kits, they are also complemented in some projects with longer term kind of prevention. For example, heat stroke prevention programs, self-care trainings, longer-term water, food, and security programs. So both are hand in hand. This very kind of immediate response together with a longer-term planning and prevention, which is, of course, very critical. And I will just give the last example from South Korea, maybe if next, where we, of course, also, unfortunately, suffered. I'm based in South Korea, so I can speak from my own experience. Also heat waves during the summer, unfortunately, and including what I think is called the tropical nights, which was also highlighted in the presentation, where actually many older people died during the night. Because the nights are really, really terrible, as you may witness, of course, and without an air conditioning and other cooling devices, it may be quite difficult. So I think what has been happening in Korea at the local government level as well, that response was quite good. And I have just 5 examples here. One is the cooling centers and safe zones. Of course, that is mainly during the day, where older people can go, they can use various cooling devices, but also medical services, water, etc. And secondly, home cooling support programs. So that is also quite important, especially for the low-income individuals, because actually if one is a low-income individual, the person can go to the not to the health center, but to the kind of social support center, which all of them are available across the cities mainly, and then request for additional payment. So for example, in Seoul, in one of the areas, one of the districts, 50,000 won in cooling costs was provided to about 11,000 households. So you can just go apply, of course, the criteria related to the low income. Then emergency response and outreach program, where community health workers and social officers actually do the regular checkups. They visit their home and they check that everything is okay. They also provide some cooling devices, water funds, etc. Next slide, please. Importantly, also subsidies. I think it was also in one of the bullet points, I forgot to mention, electricity and energy subsidies. That is also a very important mechanism. We have various kinds of subsidies, for example, agricultural subsidies. When we work from home, we have some subsidies to work from home. But during the heat wave, of course, there is also a need for those kind of subsidies. So awareness campaigns, I think that we have already mentioned, and smart technology integration, such as, for example, some wearable devices, which can also monitor the body temperature and send various alerts to caregivers. I'm finishing now in the final slide. I'm seeing the final slide, please. I'm seeing the chair's hand. Previous slide, please. A few recommendations. Previous slide. Yeah, it's a combined presentation. Final few recommendations, and you can read more in the report. First of all, what we are always advocating for at HelpAge is universal social pensions for older people. That is the baseline, the most critical. Number 2, digital tools and strengthening digital literacy for older people. Number 3, OP structures, the Older People's Association structure, develop more, strengthen. Number 3, portability mechanisms. This is something which has not yet been highlighted, but across the borders, across the political borders, of course, we also need to ensure that populations who are not the citizens also have access to social protection. IDs, every older person needs to have an ID in order to obtain that social protection. Of course, disaggregated data and regular research. Thank you so much, and I will hand over to my colleague, Lara.
Okay, thank you, Sylvia. It's been a pleasure to be here in this forum. Thank you. I'm Laras from Survey Matter. Okay, I will continue the presentation about the population aging and also heat stress in Indonesia. So given the temperature anomaly in the 9 hottest regions of Indonesia, We believe that heat stress is currently occurring and is projected for the near future. Data shown by the Climate Central in this table in June 2024, so it's quite recent, likely to remind me that the global average temperature almost hits 1.5 degrees Celsius warmer than early industrial level. So in Indonesian context, despite having consistent temperature throughout the year, tropical regions have begun to experience frequent extreme heat as projected on the screen table. Most of the regions are experiencing heat-trapping pollutions due to the high humidity level and also dense populations. The temperature itself in the Makassar, as shown in the table, even broke the monthly global temperature record, exposing the anomaly heat temperature to 1.2 degrees Celsius within 90 days. And in Cilacap region, the green color of the table, near to the place where we conducted a recent study for our investigation on design work among older people engaging nature-based solution, the temperature itself increased by 0.5 degrees Celsius over the period 67 days from March to May 2024. Next, please. So in this forum, we want to share a latest study on enhancing design works among older people engaged in nature-based solutions, the collaboration between SurveyMatter and also HelpAge. By employing a qualitative study, we produce case study of older people working in the informal sector, farmers, coconut tappers, waste collectors. The study found that older people experience design work deficits while working outside, exposed to the heat itself, and there is also a tendency for them to reduce their working time during the day, adjusting to the heat. And recently, ILO examined the impact of heat stress on design work exacerbated by the climate change. Heat stress impedes progress toward design work and social justice, especially to vulnerable workers who work outside with deteriorating working conditions and also with lack of social protections. So if the body temperature rises above 38 degrees Celsius, the physical and cognitive functions are impaired. And also it also worsened to be above 40.6 degrees Celsius. So heat stress worsened the precarious conditions of older people living in uncertainty as shown in the policy brief. One of our informants, as stated in these testimonials, mentioned that he only earned about $50 or 780,000 rupiah every season of rice production, roughly about 4 months. Next, please. Another informant who worked as coconut tappers admitted that he doesn't get paid for what he did in the community-based mangrove tourism and also conservations. Given the potential risk he faced as a coconut tapper and also the mangrove conservationist in coastal area, but also as the only breadwinner in the family, he made a decision to enroll in the recent BPJS employment, or a government-based social insurance program for informal workers. So he paid a minimum contribution, approximately only $1 in return for the employment injury insurance and death insurance. However, the social protection program has not yet integrated participation in BPJS employment for informal and unwaged workers. The older tenant farmers in this picture, who face the same heat-related risk, confess that he lacks any social protection program, like a cash transfer program, food assistance, working insurance, and definitely without pensions. So he mentions once he is sick or unable to work in the future, he will solely depend on the adult children's care. Next, please. So after publishing the policy brief, we followed the process with the stakeholder consultations in order to bring the ideas back to the relevant stakeholders. In return, we received rich feedbacks from the Office of Social Affairs and the Office of Manpower, the village government, and also the BPJS employment office. And most of the feedback circulated around the topic of challenge related to the social protections for productive older people, yet in precarious conditions. The head of BPJS Employment Office described the vulnerable worker as those who independently at high risk but lack of financial means to make monthly contribution. For example, if you fall from the workplace, in the case of the coconut tappers, you will definitely die or disabled to go back to work. In this case, if they don't have any insurance or saving, you will definitely sell goods or primary asset to recover the health costs. So during the consultations, it appeared that BPJS Employment had just begun to promote the insurance for the informal sector, including older workers who were required to register before the age 65. So they disseminated the information to the village governments and suggested them to pay the minimum monthly contribution. Next, please. So in this study, we found that despite older people's in nature-based solutions and their higher risk exposed to heat, their jobs are mostly undervalued and lacking social protection. As shown in the table, most of the social protection program has not fully addressed the older people in informal economy, potentially exposed to the heat stress. For the cash transfer program and non-cash food assistance, the beneficiaries required to be registered in the DTKS, or integrated social welfare data, with the preconditions of older people registered with a single family card in independency state and also with or without family support and have no income, employment, or pensions. There are also program managed by the Office of Social Affairs at district level with a regional budget, but in a minimum coverage like a living allowance, program for older people outside the nursing home, and also the program providing daily meals for neglected older people. In the time of shock, there is also a direct cash assistance from the village fund, known as PLTDD. The allocation is up to 25% of total budget from the village fund. Most importantly, government also provide the contribution assistance recipients for National Health Insurance Program. However, when older people enrolled in the BPJS, the insurance, are barely doing a health check, government can deactivate the insurance for the sake of the regional budget savings. In our case study, our informant are only used to claim insurance only in emergency conditions due to the accident or the shock, instead of the regular health checks. So due to the infrequent use of BPJS PBI, our informant must follow specific procedure, even though this procedure to activate the BPJS, the insurance, often lacking communication. And then next, please. The last recommendation for Indonesian context. So in response to the heat stress risk and also December deficits conditions among the informal workers, some recommendation need to be addressed. First of all, to expand the coverage of social protection for all the people working in informal sector. They are often perceived as less dependent, not benefiting from social protections. So first, we need to subsidize employment insurance to increase heat resilience and minimize the productivity loss. And then the second one, and for the contributory, we can also provide the affordable contribution starting from €1, and where the village or local government can integrate and provide funds for this program. So the second one, ensure the universal health coverage and provide home care for older people in response to the heat that potentially worsen age-related health conditions, including heart, lung, and also kidney disease. And the second one, to incorporate social protection in climate mitigation adaptation strategy, as well as the cooling action plan. So recently, Indonesian has been published just in August, cooling action plan. Yet in this scheme, there is still lack of older people needs in this context. And so we need to introduce rewards for the community-based conservation or biodiversity, all the nature-based solutions initiative. And then the second one, we also need to, in the time of the heat shock, the projected heat shock, maybe providing cooling kits and also the free safe drinking water to older people as the most vulnerable groups exposed to intensifying heat stress. Okay,
Great.
Thank you from me.
Thank you so much. A round of applause for both Sylvia and Lilis. Thank you so much. So now we heard some of the global trends and global actions across the world, as well as we also heard some Indonesia-specific case studies. Now we will move into a bit of an action amongst you in terms of discussing what you heard and what we can do together. For that, I will request Bella to explain what will happen next.
Thank you very much, Sherian. So, as Sherian has mentioned, you've heard some diverse perspectives up here from experts in different disciplinary areas or sectors. It's now over to you. You are a diverse audience from diverse geographic locations, and we are eager to understand where you see opportunities based on your perspectives in both policy and practice to contribute to age-sensitive interventions, particularly as they pertain to social protection, health and social care services and systems. And we'll, as I said, collate those responses and have probably about 1, maybe 2 tables report back in the final 5 minutes of our session. Thank you very much and enjoy this interactive activity together.
Can you come back to the plenary now? Thank you. I know it's not time is not enough, but I hope that you made a good start and good connections at the table. Okay, can you all focus now back to the stage here? Great. Lot of laughter, yeah. Okay, can you all focus now? Report back now. So we don't have much time. However, that table, can I listen couple of points that you discussed, which is so important, yeah? Just 2 points, 1 minute, if we can share someone from the table. Yeah, what are the 2 points that you are really stuck with?
1 minute.
Yeah.
Okay. Should I stand up?
Yeah. Stand up and yeah.
Okay, good afternoon, everyone. My name is Fabian, representing Indonesia, Bali, working in an NGO focused on agriculture. So today here in this group, I think we should win the most diverse group. We have someone from Maldives, from Thailand, from the Philippines, from India, and Indonesia, of course. And we talked about a few points. Everyone here has different expertise. And starting with several of our expertise, which is in agriculture, is how can we address heat stress in terms of and create an age-sensitive resilient system is currently a lot of us are working on urban farming. So how can we create reduced heat stress in cities through creating a learning center, farming learning center where intergenerational, younger children and even the elderly can participate. And also we briefly talked about others' expertise in social protection and addressing maternal leaves, and how can we encourage more protection for women? Because as we know, and we talked about briefly, there's no such thing as salary for caregivers or people at home. How can we actually address those? And maybe in combination, we didn't actually talk about this, how can we create farms as learning centers, as inclusive of gender and age, to be, in the end, address the needs of the households. So we reduce the workload distributions in the house in terms of gender. And we don't have a particular solution for this, but this is something we want to talk about.
Thank you so much. Good. Any additional points? Give a round of applause. Any additional point from this group? What else you have discussed? Two good points which you have discussed, yeah?
Especially to changing the media narrative. Media is one of my friend tell us that media is trying to put senior citizen as a victim and they have created all the problem of climate related. But we feel that senior citizen is providing solution and they are leading from the front. A lot of a lot of countries they are giving the solutions. So we are adding this point.
Good. Excellent.
Anything else?
Any point? Any additional point? Yeah.
I think one other point that came up was due to the heat wave, designing facilities which have enough green space for rehabilitation and physiotherapy for the older people so that it is safer for them as well.
Okay. Great. Thank you. Very good.
Thank you.
This table? Anyone from this table?
No, we discuss one of the things is social forestry because when heat wave took place for deforestation, there is a heat wave intensified and affect older people. If older people engage in a group forestation, it will mitigate the negative consequence, and older people also engage and take a proactive role in protecting the climate.
Right. Thank you. Thank you so much. This group, Alicia, you have, in addition to.
Okay. So we have a very great discussion in this table. So responding to the topic in this presentation is mostly about heat, but we also acknowledge that there are a lot of other risks in Indonesia, especially, for example, forest fire and then flood and also landslides. So I think it is also important to have a very thorough research on how to raise the awareness of the elderly people on how to mitigate themselves during those kind of disaster happening. And then we also know that maybe it is important to have a multi-stakeholder and cross multidisciplinary research, because in Indonesia it is not a combination between the climate crisis, climate change, and also elderly. So it is a very good opportunity for us today to discuss this in this room. Thank you.
Thank you so much. Any last one? Oh, that group, Philippines. You can't avoid Philippines, yeah.
Yes, in the Philippines, we have the Senior Citizens Affairs Office. It's a local government office. It's a local government unit for person with disabilities, and they are receiving 1% budget allocation from the local government. We would like to maximize the 1% budget to use in a climate resilience programming rather than use it in socialization, etc. Because they have the social pension budget, so it's different. So the budget allocation should be used for the programming or resilience building. Because when we talk about older person, and we also talk about person with disabilities, when we ask about climate change, they are not engaged in the discussion on climate change. awareness level, they have very low awareness level on climate change, but they are experiencing the impact of climate change. But in the discussion, in drawing out solution how to mitigate the impact of climate change, they are not included, but they are experiencing it. So that's why we want to include them, we want to engage them, and we want them to be in the forefront in the discussion, in the leading awareness raising on climate change at the community level. So the 1% budget can be used for designing program for climate resilience awareness raising. Thank you.
Thank you so much. Thank you so much. It has been a fascinating conversation and also very interesting point. So there are 4 or 5 things I just want to underline. Heat stress and the impact of that heat-related challenges with the health and other issues are real for older people. There are good examples and innovation to adapt to the situation, so we heard about it. Third, older people can be the leaders that this table highlighted, and they can also contribute to the climate adaptation. And you have a very good 1% budget allocation. How do we use it for climate resilience? A good example is there. Government must respond to the needs of this potential threat, the heat stress, and adapt social protection mechanism so that we have discussed. The data in this area is limited, but I am really glad that we could really put together this session. There are various researches happening, but there are more researches needed to really link climate change and the older people and what are the impacts, but at the same time, what we can do together. So I just want to thank all the presenters again, Belle, Sylvia, Larissa, Lilis, and everyone. And also, I just want to thank Asia Development Bank for providing and curating this session, and also the partnership with C40 and also HelpAge International. Thank you, everyone. Enjoy your coffee and go to the next session. Thank you for.
And thank you very much to Sherian for moderating the session.